Welcome back to Blocking the Flame, Anakinra and COVID, the podcast where we break down the science of inflammation, immunity, and how targeted therapies are changing the way we treat COVID-19 and long COVID. I'm your host, Gaganasri, and today's episode is titled The Immune Overdrive Cytokine Storms in COVID-19. We're diving into what happens when immune system grows from protective to destructive, a phenomenon we now know too as the cytokine storm. With me again is Aseema. Welcome back, Aseema.
Thanks again, Gaganasri. I'm always happy to nerd out about the immune system.
So today let's start right at the core. What exactly is a cytokine storm?
Well, at its heart, a cytokine storm is an uncontrollable immune response. Normally, cytokines, which are small signaling proteins, act like messengers that help coordinate an immune defense. But during a cytokine storm, that messaging system goes a little haywire and you get a flood of inflammatory signals that cause the damage to healthy tissues and not just the pathogens.
And this hyperinflammation has been one of the defining features of severe COVID-19, right?
Yeah, absolutely. So, especially in critically ill patients, those in the ICU or on ventilators, you often see elevated levels of cytokines like IL-1 beta, IL-6, TNF-alpha, and interferons. So, these molecules drive inflammation across the body, leading to lung injury and blood vessel leakage, clotting issues, and sometimes even multi organ failure.
So what triggers this immune overreaction in the first place?
Well, it starts with the immune system recognizing the virus, and cells like macrophages and dendritic cells detect parts of the SARS-CoV-2 virus using pattern recognition receptors, sort of like molecular security scanners. And this activates inflammasomes and transcription factors like NF-kappa B, which then ramp up production of pro-inflammatory cytokines. And that's totally normal in the early phase of the infection. But if viral load stays high or the immune system fails to regulate itself, things kind of escalate into kind of a storm.
So it's like the immune system steps on the gas but forgets to use the brakes.
Oh, exactly. So, yeah, it's a runway system. And in COVID-19, studies have shown that higher levels of cytokines like IL-6, IL-1 beta, CXCL10, and GM-CSF are linked to poorer outcomes. And it becomes a self-sustaining loop of inflammation.
The main question is, are there any warning signs, early markers that suggest someone might be heading towards a cytokine storm?
Yes, clinicians often look for elevated C-reactive protein or CRP and ferritin, D-dimer, and LDH in blood tests. These are indirect markers of inflammation and tissue stress. In research settings, direct measurements of IL-6 or IL-1 beta in the blood are sometimes used, but they are not always practical in the routine care. An emerging marker is suPAR, which is a soluble urokinase plasminogen activator receptor. It's being explored as a predictor of progression to severe COVID.
So you mentioned earlier that lung damage is a key concern.
Yeah.
What's the connection between cytokine storms and respiratory failure?
Well, the lungs are often the ground zero in case of COVID-19. When the cytokine storm hits, immune cells infiltrate the lung tissue and release molecules that increase the vascular permeability. And that causes the fluid to leak into the alveoli, that is the tiny air sacs where the gas exchange happens. And this leads to ARDS or acute respiratory distress syndrome, as we know, where the oxygen can't properly enter the bloodstream.
Okay, so from my understanding, it's not just the virus doing harm. It's the body's overreaction that causes much of the critical illness.
Exactly. In fact, in many cases, it's the host response, not the virus itself, that tips someone into severe disease. And that's why researchers and doctors are exploring ways to modulate the immune response, not just fight the virus.
So that brings us to immunomodulatory therapies like Anakinra. We'll explore that in depth soon. But before we close, I want to clarify something really badly. Is the term cytokine storm always accurate, or is it a bit of a catch all?
Oh, that's a great point. So, cytokine storm has become a bit of a buzzword, I would say, but immunologists are careful with it. Not every severe case of COVID-19 meets the criteria for a true cytokine storm syndrome like HLS or MAS. Some cases are better described as hyperinflammation or immune dysregulation, and still the term helps clinically frame what's happening, especially when thinking about disease progression and treatment strategies.
So it's a bit of shorthand, but a useful one,
Yeah,
especially for identifying patients who might benefit from therapies like Anakinra.
exactly.
Thank you, Aseema, for another crystal clear explanation. You really brought the storm into the focus.
Thank you. I'm really excited to dive into the therapy side of this in our next session.
Now, next time on Blocking the Flame, we'll zoom in on Anakinra, how it works, what makes it different, and why it's part of the conversation when it comes to treating inflammation in COVID-19 and beyond. This podcast is for educational purposes only and should not be taken as medical advice. Please consult a healthcare provider for any medical concerns. Thanks for tuning in. See you in the next episode.